Welcome back to the Pro PA podcast, where we discuss all things relevant to PAs, PA students, and healthcare professionals. I'm your host, Prof. G. Before we get started, I want to note that today's topic will be presented in a nonpartisan, non-biased manner. My goal is to deliver the facts about the U.S. withdrawal from the World Health Organization and what this decision could mean for providers and our patients. This episode is not about politics or opinions. It is about understanding the potential implications of this move on healthcare and patient care. Let's dive in. So, first, I want to talk about the background and what exactly happened. On January 20th, 2025, President Donald Trump signed an executive order to begin the process of withdrawing the United States from the World Health Organization, or WHO. This action took place on his first day of office during his second term and signaled a renewed stance on global health policy. The WHO, a United Nations agency established in 1948, plays a critical role in coordinating international health responses, establishing global health guidelines, and providing support for disease prevention, outbreak control, and research. Former President Trump had previously announced plans to withdraw from the WHO in 2020, citing concerns over the organization's handling of the COVID 19 pandemic and alleged bias towards China. While this decision was reversed by President Joe Biden in 2021, the withdrawal was reinstated during Trump's second term. Under the WHO regulations, a formal withdrawal requires a 1-year notice period, meaning the withdrawal could take effect on January 22, 2026. The US contributes between 400 million and 500 million annually to the WHO, which accounts for approximately 15% of the organization's budget. This withdrawal could significantly impact the funding available for global health initiatives. So, what does this mean for healthcare providers? Well, as providers, we rely on global health organizations like the WHO for critical guidance, research, and collaboration. Here's how this decision could impact us in our daily practice. Number one, global disease surveillance. The WHO plays a vital role in mentoring and reporting emerging infectious diseases like COVID 19, Ebola, and H1N1. Without direct U.S. involvement, there could be delays in receiving global health alerts or participating in coordinated outbreak responses. This may hinder early warning systems, which are crucial for providers treating communicable diseases. Number two, vaccine development and distribution. The WHO has been instrumental in vaccine research and global distribution initiatives like COVAX. A U.S. withdrawal could reduce funding for these programs, potentially delaying vaccines for global health emergencies. Providers may encounter challenges accessing updated vaccination guidelines and efficacy studies. Number three, loss of collaborative research. The U.S. has historically worked with the WHO on collaborative research for chronic illnesses and emerging infectious diseases. Withdrawal could create gaps in research data, limiting resources for providers treating patients with rare or novel conditions. And number four, public health programs. The WHO supports programs targeting maternal and child health, nutrition, HIV and AIDS, and more. Withdrawal may disrupt funding for these programs, affecting vulnerable populations and the health disparities they face. All right, so what does this mean for our patients? Well, for patients, the withdrawal could have far reaching consequences. Number one, limited access to vaccines and medications. Patients may experience increased cost or delays in accessing vaccines, particularly for new diseases or global outbreaks. Number two, reduced pandemic preparedness. The WHO's role in pandemic preparedness is vital. A lack of U.S. leadership could weaken future responses to pandemics, directly affecting patient outcomes. And number three, health equity concerns. The WHO addresses health disparities worldwide. Withdrawal could widen gaps in care, particularly for underserved populations. Okay, so what does that mean moving forward? What can we do as providers? While the withdrawal decision is beyond our control, as healthcare professionals, there are some steps we can take to mitigate its effects. Number one, stay informed. Follow reliable health organizations like the CDC, the NIH, and the WHO for the latest research and guidelines. Also, ensure that you're updated on any changes in international health policies that could affect your practice. Secondly, we can educate our patients. We need to reassure them that their care remains our priority, keep them informed about potential public health challenges, and encourage vaccination and preventative care when applicable. Lastly, we need to advocate for collaboration. We need to encourage ongoing collaboration between the US and global health organizations to maintain the progress we have made in areas like vaccine development and disease prevention. All right, so in summary, the US withdrawal from the WHO is a significant decision, and it could have implications for healthcare providers and patients alike. While the future remains uncertain, our role as providers is to stay informed, advocate for our patients, and ensure that global health challenges are met with resilience and innovation. Thank you for tuning into this episode of the Pro PA podcast, where we tackle important topics to empower PAs and healthcare professionals alike. Don't forget to follow us on Spotify, Apple Podcasts, or on YouTube for more content like this. And remember, this is the Pro PA podcast, where future pros in medicine are made. I'll see you soon.